Hello, this PowerPoint was created by Emmett Massaquoi and Amarina Berkeley to give you a little bit of an understanding of neurodevelopmental disorders and intellectual disabilities. What are neurodevelopmental disorders? Well, we would like to start you with an overview that provides a description of the disorder, the types of causes of this disorder, the most common causes, the manifestations of the disorder, subheadings, the treatment for this disorder. To begin with the description, neurodevelopmental disorders, or NDDs, are mental health conditions that are mostly attributed to impairments in the growth and/or development of the brain and/or central nervous system. This may be caused either by physiological causes or environmental ones. Physiological causes of neurodevelopmental disorders often occur prior to birth and may include genetic syndromes, inborn metabolic errors, brain malformations, and/or diseases of the mother. Environmental causes happen prenatally or postnatally and may involve exposure to substances, toxins, or teratogens. Neurodevelopmental disorders, or NDDs, can also be caused by injury. This can be related to hypoxic ischemic injury, traumatic brain injury, infections, demyelinating disorders, seizure disorders, severe and chronic social deprivation. Manifestations of NDD. These deficits result in personal, social, academic, or occupational dysfunctionality. However, there are many conditions which fall under the category of an NDD, and as such, there are a wide variety of manifestations among individuals. Subheadings for NDD include intellectual disability, communication disorders, autism spectrum disorder, ADHD, motor disorders, and specific learning disorder. Intellectual disability are neurodevelopmental disorders which include a component of poor adaptive functioning. Examples would include low IQ. Communication disorders have deficit relating to language and communication. An example may be reduced vocabulary or stuttering. Autism spectrum disorder involves impaired social emotional interaction, difficulties with nonverbal communication, and restricted repetitive patterns of behavior. ADHD involves a combination of inability to concentrate and hyperactivity impulsivity. Motor disorders have an early onset and involve the lack of ability in coordinated motor skills. This interferes with everyday activities. Two examples are stereotypic movement disorders and tic disorders. Specific learning disorder involves impairment related to academic learning capacity. Examples would include dyslexia and dyscalculia. Treatments for neurodevelopmental disorders often apply a pharmacological approach and a rehabilitative approach. Specifically, medications and therapy would be targeted at improving concentration, lessening irregular or repetitive movements, and/or decreasing aggression. Efforts to enhance social and occupational functioning are also crucial. Up until this point in our PowerPoint, the statistical and factual information has come in most part from the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, 5th edition. At this point, we'd like to share visual aids and further descriptions. We provided links to two important videos. Khan Academy gives a very excellent explanation of the sufficient and necessary causes for neurodevelopmental disorders. Rally Campaign has offered Finding My Strengths, which gives a personal perspective of someone suffering from language disorder under the communication disorders subheading of neurodevelopmental disorders. This gives you a personal understanding of what the psychological and emotional ramifications of having a neurodevelopmental disorder may be. We will start with a 10-minute video from Khan Academy. To give you a little bit more information, please bear with us, and then we will resume our PowerPoint presentation.
So let's take a look at a few of the more common events that can cause neurodevelopmental disorders. And maybe let's do that by sort of categorizing them here.
So let's draw a line down here and pop nature down on this end and nurture on the other end here. So now we've got a little spectrum that goes from nature all the way to nurture. And you've probably heard these terms before, nature and nurture. And what we mean when we say nature, what we're talking about are things that are innate, things that we are born with. So, for example, our DNA, our genetic instructions we have inside of ourselves that tells our body what to do and what to make. This is part of our
just
kind of
kind
in
of in
general.
general.
We'll
We'll
look
look
at
at
some
some
specific
specific
examples
examples
shortly,
shortly,
but right
but
now
right
let's
now
just
let's
think
just think
broadly, just so
broadly,
that
just
we
so that
can
we
get
can
a
get a
sense of
sense
what
of what
sorts of
sorts of
overarching
overarching
causes
causes
in
in
general
general
can lead to
can lead to
neurodevelopmental
neurodevelopmental
disorders.
disorders.
So on the
So on the
other end
other
of our
end of our
spectrum here,
spectrum here,
when we say
when we say
nurture, what
nurture,
we're
what we're
talking about
talking
is
about
our
is our
environment,
environment,
all of our
all of our
personal
personal
experiences that
experiences that
happen
happen
after we're
after we're
born.
born.
So, for
So, for
example, I
example, I
recently had an
recently had an
infection called
infection called
meningitis,
meningitis,
which is
which
when
is
our
when our
meninges, these
meninges, these
protective
protective
membranes that
membranes that
cover our
cover our
brain and our
brain and our
spinal cord,
spinal cord,
they
they
become
become
infected.
infected.
So
So
I
I
developed this
developed this
infection from
infection
my
from my
environment
environment
rather than
rather
something
than
that I
something
was
that I was
born with.
born with.
And we
And we can
actually put
actually put
infections,
infections,
including
including
meningitis,
meningitis,
down here
down
on the
here on the
nurture end
nurture
of our
end of our
spectrum
spectrum
as a
as a
possible
possible
cause of a
cause of a
neurodevelopmental
neurodevelopmental
disorder.
disorder.
So
So
you might be
you might be
thinking,
thinking,
right now,
right now,
hold on.
hold
So
on.
if
So
she
if
had
she had
meningitis
meningitis
and
and if
infections like
infections like
meningitis can
meningitis can
cause
cause
neurodevelopmental
neurodevelopmental
disorders, does
disorders,
that mean
does
that
that mean
she
that
has a
she has a
neurodevelopmental
neurodevelopmental
disorder?
disorder?
And that's
And that's
actually a
actually a
really good
really good
question.
question.
And it brings
And it
us to a
brings us to
really,
a
really
really, really
important point.
important
And
point.
that's
And
that
that's
all
that
of these
all of
different
these different
events that we're
events that we're
talking about,
talking
in
about,
order
in
for them
order
to
for them to
result in a
result in a
neurodevelopmental
neurodevelopmental
disorder, they
disorder,
need to
they need to
occur during
occur
the
during the
critical
critical
periods of
periods of
development.
development.
So
So
while the
while the
fetus is
fetus is
developing during
developing during
pregnancy or
pregnancy
during
or
the
during
actual
the actual
birthing
birthing
process, or
process,
maybe
or maybe
shortly after
shortly
birth,
after
within
birth,
the
within
first
the
few
first few
months to
months
years
to
of
years
life.
of life.
And that's
And that's
why we
why
call
we
them
call them
neurodevelopmental
neurodevelopmental
disorders. Because
disorders,
when
because
these
when
events
these events
occur
occur
during these
during these
critical
critical
periods of
periods of
development, they
development, they
disrupt
disrupt
development in
development
some
in
way.
some
So
way.
for
So
me,
for
I
me,
had
I had
meningitis around my
meningitis around my mid
mid-20s.
20s.
So I
So I
passed these
passed these
critical periods
critical
of
periods of
development, and my
development, and my
meningitis didn't
meningitis didn't
result in a
result in a
neurodevelopmental
neurodevelopmental
disorder. And
disorder. And let's
let's
actually
actually keep
keep
this
this
question in the
question
back
in
of
the
our
back of our
minds because we're
minds
going to
because we're
look
going
at
to
it
look at
again
it again
shortly
shortly
when we talk
when
a
we
bit
talk a
more
bit
about
more
this
about
word
this word
cause. So
cause.
let's
So
jump
let's
back
jump
here to
back
our
here to our
spectrum. And
spectrum. And
while we're here
while we're
looking at
here looking at
nurture, let's
nurture,
pop
let's
down
pop
something
down
else. Let's
something
pop
else.
down
Let's pop down
trauma.
trauma.
And by
And by
trauma, what I'm
trauma, what
talking
I'm
about
talking
is
about
something
is
like
something
head
like
trauma,
head
maybe
trauma,
from a
maybe
car
from a car
accident or a
accident or a
fall. And we
fall.
can
And
also
we can
put
also
down
put down
deprivation. And when
deprivation.
I
And
say
when I say
deprivation, what I
deprivation,
mean
what I
is
mean is
something like
something like
temporary
temporary
hearing
hearing
loss during
loss
the first
during the
few years
first
of
few
life,
years of
maybe
life,
from
maybe from
recurrent ear
recurrent ear
infections in
infections in
infancy or a
infancy or a
toddlerhood. And
toddlerhood.
let's
And
kind of
let's
move
kind
to
of
the
move to
middle
the
of our
middle of
line
our
here,
line
and the
here,
middle
and
of
the
our
middle of our
spectrum, to
spectrum,
talk
to
about
talk
things
about
that kind
things
of
that kind
fall
of
in
fall in
between
between
nature and
nature and
nurture. So
nurture.
these are
So
things
these
that
are
might
things that
happen
might happen
before a
before
baby
a
is
baby is
born.
born.
So during
So during
pregnancy, but are
pregnancy,
due to
that are
the
due to the
environment that the
environment that
fetus
the
is in.
fetus
So
is in.
if
So
we're
if we're
exposed to certain
exposed to certain
substances or
substances or
toxins,
toxins,
maybe
maybe
mom
if
drinks
mom drinks
alcohol or
alcohol or
smokes
smokes
cigarettes while she's
cigarettes while
pregnant,
she's
this
pregnant,
can
this
cause
can
certain
cause certain
neurodevelopmental
neurodevelopmental
disorders. Or
disorders.
maybe if
Or
mom
maybe if
doesn't get
mom
all of
doesn't
her
get all of her
important
important
vitamins and
vitamins and
minerals. So,
minerals. So,
for example,
for
maybe
example,
she doesn't
maybe
get
she
enough
doesn't get enough
folate, one of our
folate,
B
one of our B
vitamins,
vitamins,
while she's
while
pregnant.
she's
So
pregnant.
these
So
sorts of
these sorts of
nutritional
nutritional
deficiencies can
deficiencies can
also result
also
in a
result in a
neurodevelopmental disorder
neurodevelopmental disorder
because
because
fetus
a fetus
relies on getting
relies
its
on getting its
nutrients, the
nutrients, the
fuel that it
fuel
needs to
that it
grow
needs to grow
properly, from
properly
mom.
from
So
mom.
these are some
So
of the
these are some
main
of the
types of
main types
events
of
or
events or
conditions that can
conditions that
cause
can cause
neurodevelopmental
neurodevelopmental
disorders. And
disorders.
I
And
promised that
I
we would go
promised that we
over
would
some
go over
specific
some specific
examples and
examples
talk
and
more
talk
about that
more about
term
that term
cause. So
cause.
let's do
So
that.
let's
Let's
do
put
that.
some
Let's put some
examples down of
examples
some
down of some
specific
specific
neurodevelopmental
neurodevelopmental
disorders. So
disorders. So
how about
how
Down
about
syndrome
Down
and
syndrome and
cerebral
cerebral
palsy and
palsy and
attention
attention
deficit
deficit
hyperactivity disorder?
hyperactivity
We'll just
disorder?
put
We'll just put
ADHD for that
ADHD
one.
for
We'll
that one.
use
We'll
these
use
three
these
disorders
three
in
disorders in
particular because
particular
each of
because
them is going to
each of
help
them is going to help
demonstrate a
demonstrate
particular
a
point that I
particular
want to
point
make.
that I
And
want to
let's
make.
actually
And let's
draw
actually
a
draw a
circle for each
circle
of these.
for
And
each
we'll
of
put
these.
the
And we'll put the
causes of these
causes of
different
these different
disorders in these
disorders in
circles
these
here. We'll
circles
kind
here.
of make
We'll
what we
kind of make
call
what we
a
call a
causal pie
causal
chart.
pie
So
chart.
if we look
So
at
if we
Down
look at Down
Down
syndrome,
syndrome
Down
is
syndrome is
caused by
caused
extra
by
genetic
extra
material
genetic
from
material from
chromosome
chromosome
21.
21.
So
So
let's
let's
put
put
that
that
in
in
our
our
Down
Down
syndrome
syndrome
circle
circle
here.
here.
Extra
Extra
genetic
genetic
material
material
from
from
chromosome
chromosome
21. And
21.
sorry,
And
why would
sorry,
this even
why would this
happen?
even
Well,
happen?
this
Well, this
usually happens
usually
because the
happens
person
because
has
the person has
3
three
copies of
copies of
chromosome
chromosome
21
21
rather than 2.
rather than
And you may
two.
have
And you
heard
may
this
have
being
heard
referred
this
to
being
as
referred to as
trisomy
trisomy
21,
21,
tri meaning
tri
3,
meaning
and
3,
somy
and somy
referring to
referring to
chromosome, and
chromosome,
21
and
because we're
21
talking
because
about
we're
the
talking about the
21st
21st
chromosome. So when
chromosome.
someone
So
has
when
this
someone has
extra
this
genetic
extra
material
genetic
from
material
chromosome
from
21,
chromosome
they
21,
will
they
develop
will
Down
develop
syndrome.
Down
So we
syndrome. So
call
we
this type
call
of
this type of
cause, this
cause,
extra
this
genetic
extra genetic
material, a
material, a
sufficient cause,
sufficient
where
cause, where
sufficient means that
sufficient
every
means that
time this
every time this
happens, so in this
happens,
case,
so
the
in this
extra
case, the
genetic
extra genetic
information from
information
chromosome
from
21,
chromosome
the
21,
outcome,
the
Down
outcome,
syndrome,
Down
will
syndrome, will
always follow.
always
So a
follow.
totally
So a
different
totally
example of
different
a
example of a
sufficient cause
sufficient
is if
cause
I
is
throw
if I
water on
throw
you, right?
water on you,
You will
right? You will
definitely get wet.
definitely
Each
get
time
wet.
I throw
Each
water
time
on
I
you,
throw
you'll
water
get
on you,
wet.
you'll
So
get
me
wet. So
throwing
me
water on
throwing
you is
water
a
on you is a
sufficient
sufficient
cause of you
cause
getting
of you
wet,
getting
whereas
wet.
an
Whereas an
insufficient cause of you
insufficient
getting
cause
wet
of you
would be
getting wet would be
maybe like
maybe So because of this is a
requirement for the development of Down syndrome, we also call this a necessary cause. Necessary, meaning that we need this to happen in order for our event, Down syndrome, to occur. So extra genetic material from chromosome 21 is both a sufficient and a necessary cause of Down syndrome. Sufficient because it alone will always cause Down syndrome, and necessary because you can't have Down syndrome without extra genetic information from chromosome 21. So with these definitions in mind, let's check out cerebral palsy next. Well, there are actually quite a few different events that can each result in cerebral palsy. Let's draw another pie chart here, and let's say that each of these represents a different person with cerebral palsy. And we could potentially draw 100 more circles here to write down all the causes of cerebral palsy. But I'm just going to use two examples for now. So in this first one here, one cause of cerebral palsy is trauma. So maybe this person was in a car accident when they were just a few months old. And let's make our other example here an infection. So maybe this person had an infection like meningitis a few days after they were born. Now this brings us back to that thought that I wanted you to hold on to when we were wondering why I don't have a neurodevelopmental disorder even though I've had meningitis. Because that question leads us really nicely into how we can use the word in different ways. So while both of these people here have cerebral palsy because of these events like trauma, these events don't always cause cerebral palsy. So because they don't always cause cerebral palsy, these are insufficient causes, right? And let's see if any of these events are necessary causes. In other words, does cerebral palsy require one of these events? Well, this person here, they developed cerebral palsy, but they never had an infection like meningitis. So meningitis isn't a necessary cause, right? We don't need meningitis in order for cerebral palsy to occur. And this person, they developed cerebral palsy, but they haven't sustained any head trauma. So head trauma can't be a necessary cause either. So none of the causes of cerebral palsy are necessary causes. Remember our example where I caused you to get wet because I threw water at you? Well, there are other ways I could get you wet, right? I could spray you with a hose or push you into a pool. Both of these will leave you pretty soaked as well. So me throwing water at you isn't a necessary cause of you getting wet because I can accomplish my goal of soaking you without it. And it's the same kind of idea for these different causes of cerebral palsy here. For both of these people, these events for them have caused cerebral palsy. But remember that there are lots of potential causes of cerebral palsy. So infection or trauma are necessary causes of cerebral palsy. So let's look at ADHD. And with ADHD, we haven't quite figured out all of the details behind the causes of ADHD, but we have discovered some events that increase a person's chance of developing ADHD. So we think that these events sort of come together and form a sufficient cause of ADHD. So let's make up an example of what this might look like. So maybe for this person, ADHD runs in the family. Maybe mom or dad have ADHD themselves. So let's put genetic predisposition down here as one wedge in our pie chart. And maybe mom smoked while she was pregnant with our kid here with ADHD. So let's put maternal cigarette exposure here, another wedge. And let's make our last wedge exposure to toxins. Maybe something like exposure to lead, old school lead paint, while the person was a young kid. Maybe he used to eat bedroom wall when he was little. I know at least one person who's done this. So we know that these events increase the chance of ADHD developing, but alone might not be sufficient enough to cause ADHD. But if we combine them together like we have here, we think that the combination might be enough, making them together a sufficient cause of ADHD. And none of these individual events is a necessary cause of ADHD because not everyone with ADHD has a genetic predisposition or was exposed to lead or cigarette toxins. So we don't need any one of these individual events in order for ADHD to develop.
I hope that video was helpful to you. At this point, I'll be turning over the PowerPoint presentation to Emmett Mesquire.
Neurodevelopmental disorders can be seen as occurrence of the growth and development of the brain, which usually manifests early in development, often before the child enters grade school. It is characterized by developmental deficit that produce impairments of personal, social, academic, and occupational functioning. Intellectual disabilities is characterized by significant limitations in both intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. Intellectual disability is also categorized into 4 different levels according to its severity, as mild, moderate, severe, and profound, and each level of severity comes with different degree of intellectual disability, which are also characterized by delayed developmental disability in children ranging from cerebral palsy, autism spectrum disorders, Asperger's syndrome, attention deficit hyperactivity disorder, also known as ADHD. According to the article, Neurodevelopmental Disorders in Children, Autism, and ADHD, many factors contribute in complex ways to brain development. These include gene expression, heredity, socioeconomic factors, stress, drugs, nutrition, and chemical contaminants. A child nervous system is more sensitive to chemical exposure compared to an adult nervous system, and only small amount is needed to cause lasting damage to the developing brains. Parental exposure to even relatively low level of lead result in lifelong reduction of intellectual function and disorders of behavior. A wide range of chemical toxins in the environment has been associated with neurodevelopmental disability, which affect an estimated 3 to 8% of the 4 million babies born each day in the United States. Some incidences of permanent childhood brain damage that occur during pregnancy are as a result of fetal alcohol spectrum disorders. Also, certain chemicals such as lead, mercury, dioxin can cause chemical and subchemical deficits in neurobehavioral development through injury to the fetal brain. Autism is a neurodevelopmental disorder characterized by an impairment by impaired social interaction as well as verbal and nonverbal communication. It is the fastest growing developmental disability, increasing at a rate of 10 to 17% annually, according to the Autism Society of America. Also, ADHD is another developmental disorder that affects the area of social skills, behavior, and communication. Medications that seems to be most effective in treating ADHD are a class of drugs known as stimulants, such as Ritalin. Neurodevelopmental disorders have increased over the past 30 years and are at least partly attributed to exposure of environmental contaminants. Therefore, it becomes imperative to mitigate environmental factors that may influence disease. It is also stated that neurodevelopmental disorder or intellectual disability affect the growth and development of the brain in other areas such as social skills, behavior, and communication. The severity of these conditions varies from person to person. Often, we cannot tell which child will be affected by any form of disability, but as parents, it is imperative that we protect the brains of our young ones as they are precious and vulnerable. Thank you.
This article is attributed to neurodevelopmental disorders in children, autism and ADHD, put forth by theenvironmentalchemistry.com, and it was written by Mona Sethi Gupta, PhD. We are also going to provide you with some national web resources for NDD. The Administration on Intellectual and Developmental Disabilities has provided the following link: http://www.acf.hhs.gov/programs/ad. Autism Speak provides this link: http://www.autismspeaks.org/. American Association on Intellectual and Developmental Disabilities, the AAIDD, puts forth http://www.aidd.org/. Building the Legacy, IDEA 2004. The link is http://idea.ed.gov/. First Signs provides http://www.firstscience.org. Thank you so much for bearing with us and listening to our presentation. We hope that it is helpful to you in your social work practice.